My name is Dr. Alistair Parker. I'm a children's neurologist based in Cambridge, and I've worked in collaboration with the initially ALD Life and now Alex for quite a few years. One of the main advantages in working with parent groups is that they will pick up an area that may be neglected by us professionals. And in particular, the area I think that a lot of families have found challenging is knowing which services to integrate into their child's care. Most children with leukodystrophy will have been diagnosed by a third level team in a big teaching hospital, but in practical terms on a daily basis it's the secondary level team who will provide all the type of specialist treatments and therapies children will need, such as physiotherapy, speech therapy, respite care, and if a child becomes very unwell in the longer term, palliative or terminal care. We specialists at tertiary level tend not to be very experienced at that, and even if we are experienced, it's difficult for us to arrange it when children are so far away. With my link referring families through to ALD Life, families affected by adrenoleukodystrophy have benefited greatly from Karen and her team's support. But it's been disappointing for me when I've diagnosed children with other rare leukodystrophies, and I can think recently of several families affected by Alexander disease, where there's no patient organisation for them. And I think it would be fair to say the families have been greatly challenged on how to engage specialist services, and in particular this confusion as to what the GP does, what the local paediatricians do, and what we specialists do at the third level. So I'm very pleased to hear that ALD Life are branching out to support families affected by any leukodystrophy with their launch of Alex, the Leukodystrophy Charity. I think this is a very important piece of work which will greatly benefit many families from leukodystrophies that are even rarer than ALD. And I can particularly think of children immediately who might tick that box. I've seen 2 or 3 children over the last few years with Alexander disease, a few with vanishing white matter, just to mention a couple of very rare disorders for which families have not been able to access a parent-led or family-led advice.